So it is my pleasure to introduce Eran Orr, who's the CEO and co-founder of XR Health. Eran, in a previous life, was an F-16 fighter pilot, and became interested in this with the Israeli Defense Force. Became interested in this space when he himself had an injury. Nguyen is co-founder and CEO of Karuna Labs, and his work in rehabilitative virtual reality particularly started with stroke-related pain. And then in 2016, he founded Karuna Labs, which is being used at a number of institutions, including the VA, UCLA, and the Cleveland Clinic. Josh Sackman is president and co-founder of Applied VR, a digital therapeutics company that allows remote pain care through prescription virtual reality therapeutics. And lastly, Eran Gani, who's the CEO and founder of Behave VR. Eran, in a former life, was chief technology officer of Humana, so has a great understanding of the intersection between the payers and patient mix and technology. So we have a great panel of design and software experts today. Particularly, all of you are in some way in the space of using virtual reality to treat pain, both acute and chronic pain. And I'm going to be asking each of you kind of questions. What I've decided to do for this is, rather than ask you kind of each the same question, I'd like to, going to be directing specific questions at you guys to explain, about a bit about, your companies and the technology and software behind it. So I'm going to start with Josh. So Josh, one of the things that Applied VR has done very well is it research. So you guys have done quite a few clinical trials on using your software for the treatment of acute pain. Can you tell us a little bit about how that's worked and some of the data that you've been able to accumulate?
Yeah, sure. Thanks for having me here, Dr. Lewis. And it's great to be part of this panel of very esteemed colleagues. So we've been involved in over 30 plus studies at this point, having published around 7. And what's been really important for us is working really closely with academic institutions, because every research study is slightly different, and every institution has pretty unique needs and unique patient populations. And so for us, it starts upstream with really doing a lot of upfront testing, feasibility testing, piloting, and making sure before a study launches, we're really prepared to understand the workflow, how patients are recruited, how the study staff is trained, how you talk about this and socialize it with patients, and then ultimately design an experience that's really easy to use. Research in itself can be disruptive to hospitals and academic centers. And so we really want to minimize the burden and make it really easy to be able to introduce a tool that's just intuitive and easy to use for patients. And so now we're about 6 years into our journey, and we've evolved quite a bit over the last 6 years and really learned a lot in terms of how to work with staff and provide the support, as well as optimize the product for what we're doing too.
Awesome. Just to throw a question, to one of the other panelists, Eran Orr, again, CEO of XR Health. You guys are taking a little bit of a different approach. So rather than having the headset itself be a standalone treatment, you guys have actually employed and are expanding this a network of digital clinicians, which the headset and the software is used as a way of tracking patients, not just their pain, but also some of their physical attributes. Can you talk a bit about that?
Yeah, so again, thanks for having me, and it's a pleasure to be with all the VR innovators in the healthcare space. So we basically, a year ago, we decided to pivot our go-to-market strategy, and we became a provider, a VR provider, and we have our own clinicians, and we are basically treating a patient remotely using VR in different modalities. Pain management is obviously one of them. And what we're seeing is that the combination of a seasoned and experienced clinician with this type of technology is very powerful. And again, we believe that like the previous speaker and most of the speakers in this conference, we believe that this technology has the potential to reduce the amount of opiates across the board and help the patient cope with injuries, diseases, and different for different use cases.
Can you also talk a little bit about, about the physical therapy applications? Because I know that was kind of, how you initially got into this, and that's one of the areas where you guys have demonstrated some real progress.
We started we started from physical therapy. That was our basically our beachhead, and basically the way that we are using VR for physical therapy is basically the patient is playing a game where the clinician can modify the entire environment according to the need of that specific patient. And while they're playing that virtual reality game, they are actually doing their exercises while we are monitoring their progress and tracking their performance within the VR. And what we are saying is that the combination of immersiveness and the movement, again, like the previous speaker mentioned, it's a very powerful combination.
Awesome. And one of the things we've seen, because we've deployed the physical therapy applications in our acute rehab unit, and one of the great benefits that we see is the decrease in patient attrition. Physical therapy is hard to get patients to want to stick with, and the fact that we've kind of made it, you guys have kind of made it into a game, really allows the patients to stay engaged. I mean, rather than kind of raising a dumbbell up, in the corner, they're sword fighting or they're boxing in VR, which and so that's one benefit is decreasing the attrition, and also they can see, their progress on a kind of line, in which that's kind of, to me, like, I may not notice a 7-degree change in range of motion of my neck from week to week, but if they see it represented in a graph, then they're going to be incentivized to keep going. And that's one of the things I think that we, all the companies are doing really well, is helping the patients to have a digital representation of their own patient, progress. Because if they get into that mode of kind of catastrophizing the pain, then, they may not realize that they've made progress. But in reality, if we're able to show them, hey, look, you've made progress over time, then that's really can help them to better understand. So Lincoln, you guys have, again, also taken a bit of a different approach. You focused, at least as far as I understand, on virtual embodiment training. And can you tell us about what that is and kind of educate us on how that works and how you use it to treat pain?
Yeah. Well, first of all, thanks, Dr. Lewis, for having us. It's a real pleasure to be here on such a esteemed panel. Yeah, virtual embodiment training in a nutshell is a way to do brain retraining to help people with dampening a threat response coming from movement. So what we do is we help people with fear avoidance. We help people with pain catastrophizing as it relates to movement. So the patients who come to us always want functional improvement. So what that really means in practice is they want, real life outcomes, like being able to play with their kids or playing sports, going back and doing hobbies like, planting plants in their garden. And all our exercises are designed to help you to do exposure therapy in VR. So we'll have environments like playing with your dog or, stacking dishes on a shelf. And what's different about us is we employ a full body avatar to do this. And what happens in VR is you put on these VR goggles and you can see your body moving in VR space in ways that you can't move in real life. And we do this by employing these visual tricks where you understate the movement, you overstate the movement. If you move a little bit or move a lot, you can also mirror movement from one side to another. And this was really effective for conditions like phantom limb pain and complex regional pain syndrome, where there are very obvious sensory motor incongruences. And a lot of this methodology was actually built on mirror therapy. So, in mirror therapy, the concept is very simple. You stick your affected arm, you have an injured arm. If you had a stroke or you're an amputee, you stick that affected arm into a mirror box and you mirror from one side to another, and you see the visual illusion of that other hand moving. And over time, what that does is it helps you to dampen the threat response coming from that hand moving, and the pain goes away. And we're really effective in treating those cases. And over the last 3 years, we've been able to create protocols around more everyday pain conditions like low back pain, more MSK conditions, and chronic shoulder pain and post-surgical pain too. So It's not new science. It's been around for 30, 40 years in the physical therapy space, and we're just revamping it and putting it into a delivery mechanism that allows us to track adherence and tune the experience around you in real time.
Thank you. You know, one of the things I've kind of learned through this whole process for the last, like being in this space progressively for the last 5 years, when I heard phantom limb pain, I'm like, well, how common is that? Like, that's not a common thing. In actuality, it's very common. Like one of the nurses on the floor is like, no, we see that all the time. You just don't see it in neuro because nobody gets amputations. I was like, oh yeah, I guess that makes sense. Eran Gani, CEO of Behavior. Your company is based on a platform where at the core of it is behavioral health. And can you talk to us a little bit about how that works, and particularly about the dynamic experience engine and how that powers a lot of the treatments you offer?
Sure. Thanks, Dr. Lewis, for having us, and great to be with Lincoln and Eran and Josh. Great conference, and I would be remiss if I didn't thank Dr. Brooks as well for her great presentation on Nurture, which we're really excited about. So I founded Behavior about 4 years ago with a focus on behavioral health. My years at Humana made it incredibly apparent to me that we have a massive unmet need in behavioral health generally. Specifically within that realm, we think that fear and anxiety disorders are a great target for virtual reality. You heard Lincoln use terms like, avoidance and threat and fear, and we've talked about that a lot through the day, right? A number of speakers. So it's a great medium for that, the neurological power of VR for exposure and for dealing with issues of approach and avoidance and so on. And the thing about behavioral health is, no matter what your level of physical health, you could be a prime physical specimen like you, Dr. Lewis, with the big guns. Everybody loved your big guns on the media opportunity. But anyway, you could be in great physical health, and if you do not have your mental health, your quality of life can be really, really challenged. And I have had a number of people close to me in my family that have dealt with those kinds of challenges with unmanaged stress and anxiety and substance use disorders and so on. And it can be absolutely heartbreaking to see the impact that this has on people's lives. My Humana DNA from 12 years at a big managed care company sort of educated me about the economic effects of that as well, right? So if we're spending $4 trillion a year on healthcare in the US, about 85% of that is driven by chronic disease. And whatever your level of chronic disease burden, which already puts you in the most expensive set of the population, if you add unmanaged behavioral health conditions, your life gets a lot worse and you'll be 2 to 3 times more expensive in the system. So for those reasons, we said, okay, we're going to focus on behavioral health. Virtual reality, we think, is the ideal medium to address that, and in particular with fear and anxiety disorders. Briefly on your question about our dynamic experience engine, it's really at a simple level, it's a few things. We take information we can ingest about the patient from EMRs, information we capture from the patient about things like motivations and aspects of their condition and or goals, which some of the other panelists have mentioned as well. Of course, we can measure an incredible number of things in virtual reality, like Eran does, right? Movement and approach and avoidance and how they're interacting with this very precisely engineered virtual world. And then biometrics. And those 4 data points are captured in real time. And then on our cloud platform that we call our dynamic experience engine, we can use that to dynamically change how the session progresses for the patient. And so that gives us incredible flexibility. We're humble, and it's sort of a walk before you run. We don't try and get too fancy today. We sort of personalize by things like gender and other demographics. But it's not hard at all to see in the future, as we get bigger and bigger data sets, more and more data points about individual patients, we can both sort of diagnose or assess patients in these very precisely engineered virtual worlds, and then use that information and how they interact with those worlds to dynamically affect their journey. So we can create very personalized experiences that help them address those underlying fear and anxiety disorders that they're suffering from.
Awesome. Thank you. And one of the areas that came up earlier during Brandon Burkhead's talk was, about how to keep patients engaged in in these environments, because, especially if it's a trial, we don't know the benefit. We're kind of thinking through, and you guys, I'm sure, are doing the same thing about how do we keep the patients engaged in these sessions. Josh, could you maybe talk kind of what you guys are thinking as far as, the next generation. I mean, ultimately, I think when this is really going to take off is when we're kind of using Hollywood quality production inside the VR headsets, cause we know how engaging movies can be, and it's easy to watch a movie, you don't think about it for 2 hours, but we have trouble keeping people in the VR, for more than 20 or 30 minutes. And, other than the cyber sickness, the nausea, can you talk a little bit about what, kind of where you guys are thinking as far as strategies for that?
Sure, and I'm happy to share some recent experience. So when COVID hit, a lot of our deployments of VR, especially on the research front, came to a halt. As you can imagine, academic research centers prioritize their resources towards other things. But at the same time, people with chronic diseases like chronic pain were absent of their typical care. They couldn't go to the doctor, they couldn't go to the emergency room, they couldn't get their procedures, injections. They may even been afraid to go to the pharmacy to fill their meds. And so we saw a really unique opportunity to try research a different way, which is studying the environment of how this virtual medicine will be consumed, which is we found our patients online through Facebook and email lists. Patients came to a website, they applied to join a virtual trial. They filled out their information to see if they qualified. And upon qualifying, we shipped a headset to their home, and they completed surveys and completely self-administered a program. So zero contact from a research coordinator, zero contact from a clinician, which typically are techniques used to drive engagement. You have their doctor motivating them to actually follow the protocol, and research coordinators chasing them down to make sure they're actually using the product. And what we've seen, we launched this study with nearly 200 patients, so 188 patients, launched in July. And now we're actually closing the data collection. So in less than 4 months, we've had over 160 patients, nearing 162, I think, who have actually completed this 8-week-long chronic pain management course, which was completely self-administered. So to have an 85 or 90% completion rate for a 2-month-long trial is pretty incredible. And there are a number of things that I think contributed to that. First, as you alluded to, the design of the curriculum and the content play a huge part. And while we expect to see higher resolution, cinematic, quality, better chips in the headsets to create, better performance, those are only a small part of what we're actually seeing. It's actually creating the right dose and dosing, the right recommended frequency of use, the right duration of the content, the right kind of engagement mechanisms, the right amount of interactivity and engagement while you're in the goggles, as well as wrapping that around with text message notifications, emails that show them their progress and how they're progressing through the program, making sure up front at the beginning of the program, the expectations are really clear of why they're doing this, what they're supposed to get out of it, and what to expect. Because this isn't something like taking an opioid where you take it once and all of a sudden you have this huge rush and you feel the pain dissipate. And sure, there is, through our studies, we've seen 52% reductions in pain, some of that. But when you have chronic pain, when the goggles come off, if the pain comes back, the patient could be very discouraged and easily give up the program. And so we want to set expectations as a chronic pain patient. The goal isn't to eliminate your pain. Pain may be unavoidable. It may even be healthy depending on what you're going through. But what we can teach you to do is learn how to cope with it. Teaching skills so when the goggles come off, you're better equipped to deal with it. And so a combination of that priming and setting the stage and instructions to the wraparound services like text messaging and email, combined with a thoroughly tested program that this wasn't our first clinical trial with this. It's gone through many rounds of pilot testing, usability test in labs, condensed trials to ultimately this full 2-month-long program. And so it's a combination of factors and small tweaks over time. It's rarely one big change that makes a difference. It's a number of small adjustments that accumulate to big changes in terms of efficacy, ease of use, and engagement.
Thanks, Josh. I'm really looking forward to see the results of that trial because I know that we all are actually in this industry. It's a small space, but we all believe. Everybody on this call believes that in the data supporting the use of virtual reality for pain, and we really want to be able to get these treatments the goal is to be able to get these treatments out to patients who need it. And we're trying to, working with all of you guys to try to overcome some of these barriers. Eran, it's interesting because for you guys, actually probably for a lot of you guys, the COVID-19 era, has actually driven an increase in business because, people don't want to go into the office for physical therapy anymore. So in addition to the problem we had with attrition before, now they don't even want to go in for their evaluation. So can you talk a little bit about that and the kind of, what you guys have seen for growth in this era?
So I think that at least for us, the home use was, again, basically since we decided to go and address that specific vertical, obviously COVID accelerated everything for us in that realm. We are still facing the same problem that I think all of us are facing, which is to try to convince the user that VR is not just a gaming tool. And Facebook is not helping us, by bombarding the entire industry with all their amazing commercials. And I think that's basically, people are more open-minded to use different technology back home remotely. That's without a doubt. I think what all of us are doing, and we need more people doing it, is to convince them that this type of technology is not a gaming instrument. It can actually improve your health. So again, on one end, without a doubt, but on the other end, we're still facing the same challenges of convincing people that this new technology is something that it can help them.
Yeah, it is a challenge of getting the message out there, like, well, why do I need that? Well, because you're taking opiates, which are dangerous for you, but like Josh, like you rightly said, it isn't like they get this rush of euphoria when they take it, which you do get, if you particularly, if you're susceptible when you take opiates. So it's kind of getting people to see that this is a better path in the long term. Lincoln, can you tell me, because we haven't been able to so far deploy the Karuna technology at Hoag, so I'm a little bit less familiar about the way that it works. Is it primarily, are you guys in a clinic, or are you offering home-based solutions as well?
Yeah, we have two products. We have a clinical product that's at the VA, Cleveland Clinic at UCLA, and then we also have a home product that we launched about 2 months ago. So, we basically parlayed all the research that we did in the clinic into the home product, and we added more gaming and biofeedback to the home product. But the home product is designed to be a lot more self-directed. And we're also coming out with a self-administered model. And I think it's important to know that we're also employing a service provider network, right? So we consider ourselves a tech-enabled service provider. We have pain coaches, and these pain coaches come from varying backgrounds. We have physical therapists who are pain coaches, and we're also looking at vocational rehab coaches. And what that means is, these are folks that are good at getting people to change behavior and also to get people back to work, because right now we're really focused on workers' comp and with commercial clients, and they're all looking at return to work as a objective outcome metric. So yeah, we have a bunch of experiences that are designed to help you on all facets of life. So sports, activities of daily living, like stacking dishes and taking out the laundry, and then other activities like playing sports, playing golf or bow and arrow exercise.
Great. Thank you. And Eran Gani, so I wanted to ask you a little bit about, your recent merger or acquisition of Limbics and what that brings, because at your core, you guys are, are a behavioral health company. You and I have had conversations about how we think that digital therapeutics, including VR, are going to be the next generation of the front line of healthcare workers, with almost as a screening test or a digital referral base. And I think that the inclusion of the Limbics portfolio with behavior has a lot of potential there. Can you talk some about kind of what that adds and how you plan to deliver that?
Yeah, happy to. One thing when you mentioned Limbics, it makes me think about competition, right? And Walter Greenleaf loves to say about all of us, you know, you guys aren't really in competition. we do compete, certainly, and we think about each other and we watch each other, and I'm always impressed by the moves that these guys make. But on the other hand, this is a huge market and we're just getting started, right? It's sort of a blue ocean. So, you know, 50 million people with pain. Applied VR has probably 25 million of them, I'd say, on their platform today, but that means there's another 25 million left, right? And so competition is sort of an interesting concept in this space. That said, Limbics is a company that we got to know over the years. You know, Ben Lewis and his team, they did amazing work. We would often, because our focus is so squarely on behavioral health, we would often think of them as almost our closest competition in some ways. I mean, we all overlap, but we were tackling very similar problems. Limbics is still around. Ben and his team sort of pivoted into digital therapeutics for adolescent mental health, but off of VR. And that created an opportunity for us because they had built some really amazing stuff. They've got some great, well, I guess we now have some great IP that Ben and his team had built in Palo Alto. I won't go too deep into it, but some really neat technology and some patents and other things, and a great content library. What we found is that our capabilities were very complementary. They had not built the platform side of the equation like we have done, and it just fit together in a number of ways. So what it's going to allow us to do, first of all, we've got a larger customer base. We can sort of cross-sell and offer, you know, respective things to all of those customers, you know, whether they were previously Limbics or behavior customers. And then there's some neat opportunity to bolster our own offerings with some of the IP and the content that Ben and his team built. So it's been a great relationship. We're staying connected in other ways that I just won't go into, but you know, it's just an accelerator for us. And going back to Walter's point, you know, we all need to grow this space. There's so much opportunity. There's so much patient need. And while, you know, we all sort of have this good-natured competition, I want all of these companies to be hugely successful. That just gives us all more momentum. It'll help us attract more capital, more patients, more provider interest and traction. And so, yeah, that's some of what's going on in that kind of competitive aspect of what we do.
Yeah, and I think that, you know, as I probably should have said this in the beginning, but, you know, you guys represent, in my mind, the four kind of leaders in this space. You know, there are hundreds of you know, smaller VR, you know, healthcare startup companies. And some of them, you know, you probably won't make it. You know, like I had a meeting recently and it was, you know, he had like three 360 videos on the headset and that was it. And it was like healthcare. I said, no, you got to check out what these guys are doing at Applied and Behavior and XR Health and Karuna, because you know, this is not, like Eran said, this is not just a game and it's not just a cool experience in VR. These are designed specifically in partnership with physicians and physical therapists and clinicians, specifically to treat, you know, conditions. And you know, I think the more that we can get the message out there, as you said, you know, we all have a future that's tied, you know, to each other's, because the problem is huge. You know, the pain problem alone is huge, you know, $600 billion a year in chronic pain. And then there's, you know, the mental health, you know, burden, you know, is equally huge. So I think that, you know, we all benefit from these kind of interactions. And yeah, I think if Walter wants to, you know, to jump in, if we can activate Walter's, you know, microphone and see if he has anything to add, because, you know, he's been around and, you know, since the beginning of some of these companies, and again, understands this space probably better than anybody out there.
Okay, I'm glad to be back. Yes, I'm so excited to see the momentum here, and I think this is a watershed event to have this conference with such a confluence of experts. And we've talked about you know, down in the trenches what needs to be done. We've also talked about research, and we've also talked about sort of the business of growing and validating the very key technologies that we're going to be using here. So it's been a fantastic spectrum of presentations. And Eran, I'm so glad of competition. I think right now what we need to do is raise awareness of the power of this technology and how it can make a difference. That's the biggest obstacle for everybody on this call.
Yeah, thanks so much, Walter. And as far as raising awareness, I'm going to put my plug in for the Empower 360 Foundation, because that's, that's their mission as a not-for-profit, raising awareness around this. And Danielle and Diana are doing a great job with that, and they need help. I know we all have interest in this space. I'd like to thank our panelists, for being with us today. Josh, Lincoln, Eran, and Eran. You guys are awesome. Keep doing the amazing work that you are, because our patients, my patients, all of our patients need these treatments, and the more that we can deliver them at the level that you guys are, the better off we're all going to be.
Thanks for having us.
Yeah, thank you guys.
I agree. Thank you so much.
Thanks.